Welcome to our deep dive today. We're tackling a tough topic, how to recognize abuse and assault. We'll be looking at it through the lens of paramedics. They're often the first to encounter these situations. You may not be answering 911 calls, but what we discussed today applies to everyone who wants to understand these issues better. We've got two cases from our source material to examine, one with a child, one with an elderly man.
It is interesting how paramedics are trained to be so observant. They can pick up on really small things that suggest the situation is more complicated.
Absolutely. Our first case really shows this. It seems simple at first. A father brings his 8-year-old son to the ER, possible fractured arm. The dad says the boy tripped and fell, but when we look closer, some red flags pop up.
The source material mentions the child has tender right lower ribs with blush and purple bruising. That injury doesn't seem to fit the father's story of just a trip and fall.
Yeah, good point. Makes you think. Why wouldn't the father mention those rib injuries? And it's not just the physical injuries. The source material also talks about how important the child's behavior is. The boy is hesitant to talk about what happened. What does that tell us?
Well, hesitation like that can be a big sign of possible abuse. Children who've experienced trauma, especially from someone they trust, they often become withdrawn and scared. They might not make eye contact or hesitate to answer questions, maybe even change their story if you ask them a few times. It's really sad. But it's a crucial detail for paramedics to notice.
It's almost like they're trying to protect themselves, even if they don't fully grasp what's going on. The source material throws a real curveball. It asks, based on the color of Adam's bruises, how old might they be? I was stumped by that one. How can you tell how old a bruise is?
That's where the science of bruise dating comes in. It's been really important in lots of legal cases. You see, bruises actually change color as they heal. Fresh ones are usually red or purple. Then they turn green, yellow, and finally brown. A trained medical professional can look at these colors and how the bruise feels and estimate its age.
So if the color of the bruise doesn't match the father's story, that's a huge warning sign that something worse might be happening.
Right. And this is where understanding typical patterns of abuse is so important. The source material mentions that bruises on the back, buttocks, or any unusual areas are especially suspicious in children.
Okay, let's say the paramedic or anyone really sees these warning signs. What then? What should someone do if they suspect child abuse?
That can be tricky. Some professionals, like paramedics, teachers, social workers, are called mandatory reporters. That means they're legally required to report any suspicion of child abuse, even if it just seems possible. Think of it as a way to protect children.
That makes sense. But what about someone who's not a mandatory reporter? Like, what if I see something concerning at the park?
Even if you're not legally required to report it, I think you have a moral obligation to act. You don't have to be absolutely sure abuse is happening. By contacting Child Protective Services or the police, you let trained professionals investigate. Your concern could be the difference maker.
So it sounds like documentation is really important here.
Absolutely. Paramedics are trained to document everything in detail. How the child looks, how they're acting, what the caregiver says, any inconsistencies. This record can become vital evidence if a case of abuse is investigated.
Let's move on to our second case now. It involves an elderly man found in a troubling situation.
Yes, the source describes an 85-year-old man. He's in a messy apartment, weak, looks neglected. His daughter is there, but doesn't want the paramedics to examine him. Says he hasn't been eating or drinking. But like our last case, things aren't so simple.
What details stand out in this case? What would set off alarm bells for experienced paramedics?
Several things. The man's overall condition, weakness, not eating, found in urine-stained pajamas. Those point towards possible neglect. Then there's the daughter not wanting the paramedics to examine him. That's suspicious right away.
I see the source material also mentions the man has pressure sores. Are those a serious sign of neglect?
Definitely. Pressure sores or bed sores usually happen when someone can't move for long periods and isn't cared for properly. They suggest a lack of basic hygiene and attention to the man's needs.
Looks like we're seeing a pattern, just like with the child abuse case, putting small details together to get a clearer picture.
You got it. And this case goes even further. The source material asks, based on your partner's assessment of the patient's room, why is there a distinct possibility of elder abuse? It's almost like a detective case.
Okay, you've got me hooked. What's so concerning about the man's apartment?
The paramedics notice a few alarming things. First, the door is locked from the outside. So is the man being kept inside against his will. Then there's a lack of basic things. Food, water, clean clothes. And finally, the whole apartment is messy and dirty, suggesting neglect that's been going on for a while.
That paints a disturbing picture, a stark reminder that elder abuse is a serious problem that often goes unnoticed.
It is. And sadly, it's more common than people think. Elder abuse often happens behind closed doors, making it hard to detect. That's why it's so important for everyone to know the signs and what to do if something feels wrong.
The source material mentions some medications found in the apartment: Ritalin, Restoril, and Selendac. Is that significant?
The presence of those medications raises some concerns, especially considering the possibility of elder abuse. Medication mismanagement is unfortunately another form of abuse, and it can have terrible effects on seniors.
So it's not just whether the medications themselves are bad, but how they're being used or misused.
Exactly. Mismanagement can be many things. Giving too much medication, not enough, not following the prescription, even using medication to sedate or control an elderly person. These are all forms of abuse. In this case, the specific medications Ritalin for ADHD, Restoril for sleep, and Selenduc, an anti-inflammatory, could have serious side effects for an elderly person, especially if they're already weak and dehydrated. And the fact that Ritalin, usually for ADHD, is in the home of an 85-year-old man raises questions about possible misuse.
It's incredible how much paramedics can figure out from little details. It really shows how important they are in protecting vulnerable people.
You're right. And although we may not all be paramedics, I think there's a valuable lesson here for everyone. It's about being observant, paying attention to the details, trusting your gut feeling when something doesn't seem right.
I agree completely. It's about recognizing that even the most vulnerable people in our society deserve our attention and protection.
Absolutely. And we've just scratched the surface of this complex issue. There's much more to explore.
And we will. In the next part of our deep dive, we'll go deeper into different forms of abuse, the terrible consequences, and most importantly, what we can all do to prevent it.
You know, it's easy to feel kind of overwhelmed by all this, but we're not powerless. There's actually a lot we can do to stop abuse before it even starts.
That's good to hear. I have to admit, after those two cases, I'm feeling a little down. So what can we do to prevent abuse? Where do we even begin?
Well, education is really important. Think about those programs that teach parents how to discipline in a positive way, manage stress, and communicate better. Those can make a huge difference.
Right, giving people the tools they need to handle tough situations. It's about getting to the root of the problem.
Exactly. Abuse often comes from not knowing how to cope, being super stressed, or having unresolved trauma. If we can support families, especially those struggling, we can prevent abuse.
What kind of support are we talking about?
Think about affordable childcare, access to mental health services, strong social support networks. These things can help families deal with stress and prevent abuse.
So it's about creating a safety net, making sure families have what they need to thrive.
Exactly. But prevention goes beyond individual families, too. We need to look at society as a whole and challenge those cultural norms that say violence is okay or that minimize it.
Can you explain that a bit more? What are some examples of those norms?
Think about how aggression is often shown in movies and TV, or the harmful stereotypes about men and women that still exist. Even the way we talk about discipline can contribute to a culture where abuse is more likely to happen.
So we need to create a culture of respect, empathy, and nonviolence. That's a huge job, but it seems crucial.
It is a big job, but there are some encouraging signs. For example, the way we talk about consent has changed in a positive way. The hashtag #MeToo movement really brought this issue to light, and now there's more emphasis on respecting boundaries and understanding consent in all areas of life, not just in sexual situations.
That's really important. We need to teach kids from a young age that they have the right to say no, to set boundaries, and to be treated with respect.
Absolutely. It's about empowering people and challenging those power imbalances that can lead to abuse. We need a culture where everyone feels safe to speak up and knows their voice will be heard.
It's good to see those conversations happening more openly and that there's more awareness about consent now.
There's also more awareness of domestic violence.
Mm-hmm.
It used to be something people didn't talk about, but now there are more public campaigns, more resources for victims, and more people willing to speak out against it.
That's so important. The more we talk about these issues, less stigma and shame there will be, and more people will feel comfortable seeking help.
I agree. It's about creating an environment where abuse is not tolerated and is addressed quickly and effectively.
So preventing abuse is the ultimate goal, but we also need to talk about what happens after abuse occurs. What about the victims? What support is there for them?
That's a key question. Healing from abuse can be a long and difficult process. It often requires specialized help. Thankfully, there are many resources available, depending on the type of abuse and the individual's needs.
What kind of resources are we talking about?
Therapy and counseling specifically for trauma survivors are essential. Support groups can also be helpful. They allow survivors to connect with others who understand what they've been through, which can be very validating and empowering. And there are organizations that provide practical help, like legal aid and housing assistance.
So, even though we're talking about some very difficult topics, it's encouraging to know that there are people and organizations dedicated to helping survivors heal and rebuild their lives.
It really is. And it's important to remember that healing is possible. With the right support, survivors can find hope and resilience.
That's a powerful message. It's easy to feel hopeless when facing these issues, but knowing that help is available makes a big difference. It's a reminder that even in the darkest times, there's always light and hope for a better future.
And speaking of hope, it's important to recognize that the fight against abuse is something we all need to be part of. It requires awareness, knowledge, and active involvement from everyone.
You're right. The problem may seem huge, but even small actions can have an impact, whether it's educating ourselves, speaking out against abuse, supporting organizations that help survivors, or just being kind and compassionate to the people around us. We can all contribute to creating a safer and more just world. As we've been talking, it occurs to me that recognizing abuse isn't just about seeing the obvious signs. It's about understanding the subtle ways it can show up too, especially in different cultures.
That's really important. Abuse have many forms, and what's seen as abusive in one culture might not be in another. We have to be sensitive to those differences and not make judgments based on our own cultural biases.
Can you give an example? I'm having trouble picturing how cultural differences could affect how we see abuse.
Well, think about disciplining children. In some cultures, it's considered okay to use physical discipline. In others, it's completely forbidden. We need to understand those differences. Approach each situation with an open mind. Try to understand the context before judging.
So it's not about forcing our own values on others, right? It's about recognizing that cultures have different norms and beliefs. That makes sense, but it seems complicated. How do we deal with that? How can we recognize abuse in a culture different from our own?
It takes a combination of things: cultural sensitivity, careful observation, a willingness to ask questions. It's important to build relationships with people from different cultures, learn about their customs and beliefs, and be respectful of their points of view.
So open communication and genuinely wanting to understand are key.
Absolutely. And I think it's just as important to be aware of our own biases. We all have them, even if we don't realize it. We need to be mindful of those biases and challenge them whenever we can.
That's a great point. It reminds me of that quote, "We don't see the world as it is, we see it as we are." Our own experiences and perspectives shape how we interpret things.
Exactly. And when we're dealing with something as sensitive as abuse, we need to be extra careful not to let our biases affect our judgment. We have to approach each situation with empathy and a willingness to learn.
This connects back to what we discussed earlier about education and prevention. The more we know about different cultures, the better we can recognize and address abuse in all its forms.
Exactly. It's about creating a world where everyone feels safe and respected, no matter their cultural background. That's the kind of world I want to live in.
Me too. And that's a perfect way to wrap up our deep dive today. We've explored a lot, from the subtle signs of abuse to the impact of cultural differences. It's been a tough but important conversation.
It really has. I hope our listeners feel empowered to act in their own communities, to speak up for those who can't, to work towards a world where abuse is no longer tolerated.
Well said. Remember, knowledge is power, and together we can make a real difference. Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay engaged.